kind of treatment do you advise or you do in your facility here?
Treatment depends on the type of functioning that the patient is at right now. If a patient is functioning well, if he's able to maintain his social obligations, he can even receive, outpatient department treatment. He can come to the clinics and try to, you know, do psychological therapies every once a week. That can also that can be arranged as well. That is something which works for some people. But for people who have been in addiction of things like opiates, like heroin, people who are addicted to alcohol, most of them do require inpatient treatment. And the inpatient treatment that we work on initially focuses first on detoxification for the first few weeks, so that their body recovers initially, because a lot of them have serious health consequences because of addiction. So once they have achieved a sort of a stability in terms of their health, then comes the part of the active treatment, psychological part of it. There are a number of different types of therapies which have been found to be useful for addiction. I think they're all equally effective, but it's just patient preference what they prefer. Some of them are, what we call motivational enhancement therapy, relapse prevention therapy, also the 12-step program. I'm sure you must have heard of it. The Alcoholics Anonymous, Narcotics Anonymous. Those 12-step principles also work for some people. And then, so personally, in our center, what we use is what we know as a self-management and recovery training. Goes with the acronym of SMART. So this is a very structured form of therapy where we have a workbook. It is basically based on the principle, on the same therapies which I mentioned earlier. This sort of therapy is practiced in a number of different countries, and it's a very fact-based module based on rational emotive behavioral therapy. And this form of therapy is what we offer. It's conducted over a 6-week period, so 6 to 8 week period. So this is a major form of psychological treatment which we offer. And then, as with any form of psychiatric treatment, we have done the biological part of healing the body. We have done the psychological part of teaching skills to patients, how they can be, self-reliant and stay away from drugs. And then finally comes the rehabilitation part. Once again, integrating these people into the society. Finally, coming to the rehabilitation part of it, which involves occupational rehabilitation, functional rehabilitation. We have professionals. We have professional psychologists, social workers. We have occupational therapists. So these then slowly help in reintegrating the patient back into the society. So any sort of treatment for addiction should have a good psychosocial rehabilitation plan, and gradually we are uh, it as I said, it does not work on every patient. Addiction itself is a chronic condition, so it has its ups and downs. But the problem that the best thing we can do for our patients is to have faith in them and just treat them with the respect and dignity they deserve.